Okay, I'm just showing something here. We've got person's head, of course, and got the brain, the spinal cord coming down. I'm showing the vertebrae there. I haven't talked about the vertebrae much. These guys are protective little things, or protective bony structures. They're bones, and they kind of stack one on top of the other, right? Kind of like building blocks, right? Kind of stacked there, and they have some ligaments on the side that hold them in place. In between each one, there's a layer of cartilage. That's a good shock absorber, and it also allows them some flexibility. Bone on bone, it would just rub each other and wear each other off. So it gives that shock absorber and creates the ability to move without a lot of friction between the bones. And I just kind of drew to the side here what, like if you cut right down the middle of them, you can see that there's one stacked on top of the other. And the blue there is supposed to be the shock absorber. And the main reason I'm showing this is because sometimes what happens is, and you got to remember, the spine, you have the spinal nerves coming out here, right? And they come out and they fit through a little hole, not where the pad is, of course, but there's a little foramen, and I can't really show it on here. But they fit through there. So what can happen is this little pad, can happen and does happen very, very often. It's a common thing to happen. This thing here, if you would draw it over here, it's kind of a disc like this, and it's fluid filled. That thing there, that guy there can get crushed. And it gets crushed, and it can stick out here. And it can slip out, right? So now instead of being in place there, it's crushed, so these bones here have come down, and it's sticking way out like this. And you can see that it's pushing on the spine there. It's pushing on one of the spinal nerve that comes out here. Can push on the spine, but usually what happens is because you've got the spinal nerve coming out through the between two of these. When that gets crushed down, the disc might push on the spinal nerve or one of the roots, or it may have just crushed down to the point where you've got problems where the spinal nerve doesn't have room fitting through there. And you can also get, from this here, you get inflammation in the area and get edema, and it can cause problems with the spinal nerves. So you get a slipped disc, and I just wanted you to know what I was talking about when I'm talking about a slipped disc, or they'll also call them a compression fracture, where these guys just get smashed down or compressed, and sometimes even the vertebrae themselves have suffered fractures that the person doesn't even know about, and they end up really crushed down too, right, and out of place. So it can cause problems there. Go back to the cross section of the spine. So right here is the spinal nerve. That's what I was talking about. That's the part that comes out of the vertebrae. It's the part that comes through the hole that's made for that to come out of. So when you get a slipped disc coming in, you got to think about what the symptoms are going to end up being. If you're getting pressured out here in the spinal nerve, the part right there that's coming out, what kind of symptoms can you have? Well, you can very easily have the motor nerve is going through there, and the sensory nerves. You've got your sensory nerves, and you've got motor nerves going through there. If you get pressure from a slipped disc pushing on here, that's what you're going to have. You're going to have involvement of sensory, which will be numbness, tingling, maybe a lack of feeling. Usually this is in your lower spine. If you think about it, a compression fracture, a problem with your disc is usually in your lower spine, because what part of the spine is carrying all the weight? Up on the neck, it's only carrying the head. You do not, without injury, you do not very often get slipped discs in the neck. Not that you can't. In fact, that's probably when most people will end up going to a chiropractor, because they seem to be the only ones that really know how to work with the neck real well. But anyway, but you can have problems with the neck, but much more common. In fact, it's super common to have compression fractures, slipped discs, down down in the lower back, right? The lumbar sacral region is where you'll get them a lot of times. But anyway, so what happens out here? You're going to have, if it's pressure on the spinal nerve, you can and probably will have involvement of weakness. So involvement of your motor, so you're going to have weakness because your motor nerve isn't working as well. And like I said, it takes groups of nerves to do anything. Well, this one might be affected, but the other ones aren't. So it's not always real noticeable, but it is noticeable. The patient can tell you, yeah, I haven't been able to do this, or this has been a little weird. Another thing is numbness. Maybe they got numbness and tingling down in their feet. Don't have feelings down in their feet. And weakness in their legs. So if they got all those, you can figure, okay, pressure's out here. Let's say that you got one of these discs and it's pushing in here and it's pushing just on the dorsal root, right? So now it's pushing inward on the dorsal root. So by putting pressure on the dorsal root, what will the person's symptoms be? Well, what's going through the dorsal root? Sensation. So they may have a lack of sensation, and they may have numbness and tingling, right? Because the sensation part is what's being affected. Now let's say this one's affected. Then you're going to have weakness, right? If it's pushing on the anterior root, that's the one that the motor sensation is going through, right? So the motor impulses are going through the anterior root. So if that one's being affected, they have weakness, right? So then they're going to have weakness, and like I said, down in the legs, because it's usually where this is. So those are their symptoms. Spinal nerve can have weakness and sensation, and dorsal root, sensation deprivation. Anterior root would mean motor deprivation, right? So numbness and tingling, weakness down here, right? So that's how those symptoms come about from slip discs. And I don't have a number, but a huge percentage of our population, especially when you get over 45 or so, huge percentage of our population has problems like this. A lot of them just plain old ignorant. Especially when you run into guys who have been working heavy, hard work for years. They tend to have gotten this slowly and over time, and they like to just ignore things. But all of a sudden, when they come in and you're talking to them about this, you'll find out, oh, and you've also had numbness in your feet for years. And the thing is if it's affecting one side, it might be in one foot. Affecting both sides, it'd be in both feet.